At the heart of Nigeria's journey towards sustainable development lies a bold commitment, not just to global ideas, but to practical, measurable change in the lives of its people. Since the commencement of the implementation of the Sustainable Development Goals in 2016, Nigeria has taken deliberate steps to translate ambition into action. Central to this national effort is the Office of the Senior Special Assistant to the President on Sustainable Development Goals, OSSAP SDGs, the coordinating engine driving implementation, partnerships, and impact across the country. Through a strategic blend of policy alignment, targeted interventions, and inclusive partnerships, OSSAP SDGs has continued to bridge the gap between commitment and delivery. Across Nigeria's diverse landscape, this commitment is visible. In underserved communities, programs and projects of OSSAP SDGs are transforming lives, delivering critical infrastructure such as mother and child hospitals, primary healthcare centers, classroom blocks, water supply systems, and skill acquisition centers, among others. These interventions are not isolated efforts. They are carefully aligned with national priorities and local needs, ensuring that development reaches those who need it most. Through sustained investment in the Basic Health Care Provision Fund, OSSAP SDGs has constructed and equipped over 40 units of 100-bed Renewed Hope Mother and Child Specialist Hospitals, 30 units of 80-bed Mother and Child Centers, 34 units of 40-bed Primary Healthcare Centers, and 144 units of 20-bed Primary Healthcare Centers, and 10 advanced 30-bed Primary Healthcare Centers to strengthen Nigeria's primary healthcare system, especially in rural areas.
Our President has promised that they will bring the governance to the grassroots, and that's what is evidence now, and that Nigeria will bridge a new system of governance where every aspect of governance will be felt by people in the local community, the foreign community, everywhere must be taken care of. And that's what it's all about. And I charge them to please be supportive. They should have trust in the president. He's a man of his word.
In the education sector, the office has championed initiatives that promote access, equity, and quality, supporting the construction, furnishing, and rehabilitation of schools, provision of learning materials, and creation of safe, inclusive learning environments, particularly for vulnerable children. In total, the office has constructed over 11,843 classroom blocks, with an additional 383 blocks rehabilitated or furnished with desks and learning materials to ensure improved learning environments.
This moment is a demonstration of the power of collaboration and commitment to the well-being of our most vulnerable children in the society. This project also reflects the commitment of His Excellency President Bola Ahmed Tinubu CFR to the well-being and development of all children irrespective of their background, as an essential pillar of development in line with the Renewed Hope agenda. This also aligns with the SDG 1 to end poverty in all its forms everywhere by ensuring appropriate social protection systems and measures for all, and SDG 11, which ensures access to adequate, safe and affordable housing for all. I thank the Senior Special Assistant to the President on Sustainable Development Goals, Her Excellency Honorable Adejoke Orelope Adefuyere, OFR, and our team for constructing and furnishing this home. I say well done and good job.
It's our role and responsibility as government, as their representative in government, and as parents to ensure that we provide the enabling environment for them, to encourage them, to educate them, not only to educate them for the sake of education, to give them qualitative education that will guarantee their future.
These projects are spread across all 360 federal constituencies of Nigeria. In the same vein, the office has supplied over 3,406,830 exercise books and 5,943 computers to enhance teaching and learning. The office has also established over 70 skill acquisition centers to equip youth and women with vocational and life skills for self-reliance. In Lagos State, several projects have been constructed and equipped to meet the needs of the people. These include specialized facilities such as the 200-bed hospital VIP wards and the Sickle Cell Care Center at Lagos State University Teaching Hospital, Lasut, the Pediatric Center at the Federal Medical Center, Ebutemeta, and an 80-bed primary health care center at Lagos State University, as well as classroom blocks and youth centers, among others.
We need to develop our youth spiritually, economically, and physically. So if you develop them spiritually, educationally, economically, without physical development, you have not done anything. So they must exercise themselves so that they can keep fit and live long. So this project is very, very important for the future leader. We don't call them future leader again, they are leader of today for tomorrow.
We're here today and we've seen commissioning. First, with the support of the Office of the Special Assistant to the President on Sustainable Development Goals, my sister and my friend, Her Excellency, Mrs. Oyelope Adefulere, who herself is a distinguished daughter of Lagos. She has supported Senator Bill to deliver on this landmark project, the most practical and most functional. It's about directly touching the lives of the people, empowering them, enabling them to live healthier, to live more prosperous, and to live better as citizens. This is also what our great party, the All Progressive Congress, stands for. A better life to all our people, to all our citizens, regardless of your age, your gender, your religion, or your income class. Our goal is to ensure that no one is left behind.
In Bayelsa State, a 100-bed mother and child hospital was commissioned in Yenagua alongside a skill acquisition center and classroom blocks in Sampor.
Our commitment to the achievement of the SDG, implementation and acceleration by year 2030 by Nigerian government. We will continue to prioritize interventions with potential impact on the lives of the poor and vulnerable population of the society, so that Nigeria is not left behind.
We are gathered here to commission a project that will make Bayelsa State women now have a place to have safe delivery. They will be safe, their children will be safe. But we will not go to traditional places to go and look for traditional medicine, but take modern medicine, modern delivery system. I've been inside there. It is equipped with the state of the art anywhere you can find in the world.
In Rivers State, a 100-bed mother and child hospital was commissioned in Okrika.
I must commend the SDGs office and commend the lawmaker for making sure that the job is started and completed. And today we're able to commission it. From what I've seen, of course, you don't need to be told of the quality that have been put in place. And to whose benefit? To the benefit of the people of Okrika, to the benefit of those who reside in Okrika, and to the benefit of Rivers people in general.
In Akwa Ibom State, a 100-bed mother and child hospital was commissioned in Okoita, Ibiono, Ibom, local government area.
Better days are here. And part of the better days that are here is what you see here standing before you. I can tell you that we have built so many hospitals, ranging from the primary health care center, specialist hospital, and mother and child hospital all across our country. The mother and child hospital that we have built in Nigeria is more than 45 all across
some states of the Federation.
The commissioning of this hospital today in our state speaks to the passionate desire of the President's renewed hope agenda to continually address the healthcare needs of the people, especially those in the rural areas, as well as his commitment to implementing the SDG goal number 3.
In Delta State, an 80-bed mother and child hospital was commissioned in Ubuawangu, Warri South local government area. In Abia State, a 100-bed mother and child hospital was commissioned in Obeaja, Ugwanabo local government area.
Looking at the environment, there's no right-thinking person that will not love what you've done. So I want to thank you. Healthcare occupies a major position in our strategy as a government.
In Imo State, a 100-bed mother and child hospital was commissioned at Owo Omama General Hospital, Owerri.
This hospital, built and fully equipped under Sustainable Development Goals initiative of President Bola Ahmed Tinubu, it is indeed a thing of joy for us to recall how dearly we needed a facility like this part of the state. And when we beckoned to the office of the First Lady, she graciously approved. And behold, seeing is believing. The administration of President Bola Ahmed Tinubu has provided this vital facility, which is designated specifically for the benefit of women and children in our state.
In Ogun State, a 100-bed mother and child hospital was commissioned in Ikberu, alongside a skill acquisition center in Ikene and Shagamu, among others.
Today, we're here to commission 2 out of several projects. At the last count, the Office of the Senior Special Assistant to Mr. President on Sustainable Development Goals has funded about 80 projects across the length and breadth of Ogun State. It's important to properly inform all of us that this office is situated in the presidency, and all her activities are because of the leadership that Mr. President has provided through his identifying and adopting the 2030 Agenda for Sustainable Development, which evolved into the 17 SDG goals. He assumed office, and we looked at the national statistics of infant mortality. We realized that it appeared as if we were at the higher spectrum of having more cases of infant mortality in Ogun State, and we thought we needed to do something about that. That was why we particularly requested the partnership and support of Her Excellency to put this befitting edifice in place. And as she had requested and advised, please, our women, come and take advantage of this facility.
We are here today to commission the 100-bed mother and child hospital, Ikberu. And after leaving here, we will be going to commission the skill acquisition center at Ikberu, very close to this location. These are some of the strategic interventions being undertaken by our office, OSSAP SDG, across our country. Let me from the onset appreciate the President of the Federal Republic of Nigeria for providing the needed resources to enable us to work closely with the sub-national government to deliver these key interventions to fast-track the achievement of sustainable development goals in Nigeria. In the same vein, I would like to sincerely thank the Governor of Ogun State, Prince Dr. Dapo Abiodun, for your support and cooperation in our collective desire to implement the Sustainable Development Goal known as 2030 Agenda in Nigeria.
In Ondo State, a 100-bed mother and child hospital was commissioned in Ifon alongside a skill acquisition center in Ile Oluji, among others. In Osun State, the office commissioned a 100-bed mother and child hospital in Oke-Oniti, Osogbo, a skill acquisition and entrepreneurship center in Dagbolu, Osogbo, vocational center, and transit home in Aragbiji, and an 80-bed mother and child hospital in Ikpetu Modu, among others. In Ekiti State, the office commissioned a vocational center and transit home to cater to abused women and girls. In Oyo State, major interventions include a 100-bed mother and child hospital and doctor's quarters at Abonde, Onara, as well as the comprehensive rehabilitation of the University College Hospital, Ibadan, among others.
For those who have known the perennial problem of water shortage at the University College Hospital, whereby doctors will have to use what they call pure water sachet to wash hands at times, patients have to carry kegs of water through many floors before patients are able to have clean water to drink and for other utilization. This project has made water to flow in all the wards that they are handling, because they are handling 5 major blocks. Water is now flowing to a reasonable level in all of them. So the aesthetics of the hospital has been improved because they changed our windows, they painted, and the floor, the walls, the roof, all of them are now looking new. This has improved our aesthetic appeals, because it is interesting that when we travel overseas, these are some of the things we see that attracts us to go there. And of course, I know I'm correct to say that even a good ambience of the hospital, the neatness of the walls, and the beauty of the environment also constitutes or has some healing power on its own. And of course, the office of the Senior Special Assistant to the President on SDG, Dr. Adejoke Adefulure, also helped us to install solar-powered light. This has gone around all the campus, and of course, it's a beauty to behold when you come to UCH at night. Even when there's power outage, UCH is never in darkness. It is so beautiful to behold. And these are things that has been the value addition to our institution, the University College Hospital Ibadan. We really appreciate the President. We also appreciate Dr. Adefulure for what she has done for us. We have never had it this good.
The renovation job pioneered by the SDGs is something that has turned around the ambience and then the service rendered by the University College Hospital. In a way, it has affected our tripartite functions, that is the research, service, and training. All the pipes that have rusted for years, they have removed it and then they have replaced it with a new one. Aside that, we have a kind of UCH that is having an update, new windows, new things that they have been doing. They have painted, they have done a lot of things. We are eternally grateful.
In Kwara State, OSSAP SDGs delivered a 100-bed mother and child hospital in Ilorin, an 80-bed mother and child hospital and doctor's quarters in Oro, Irekpodun local government area, and a 40-bed primary healthcare center in Ikpaja, among others. In Kogi State, a 100-bed mother and child hospital was commissioned. In Benue State, the office delivered a 100-bed mother and child hospital in Makudi. In Nasarawa State, OSSAP SDGs delivered a state-of-the-art skill acquisition center with classrooms blocks, among others. In Gombe State, the office commissioned a 100-bed mother and child hospital and a skill acquisition center, among others.
Establishing this vocational and skill acquisition center at your doorstep is a unique opportunity that must be well utilized. Our office and Gombe State government has worked closely and tirelessly to construct and furnish this skill acquisition center known as Amina Mohammed Vocational Skill Acquisition Center, Gombe State, as a strategic tool for the economic empowerment of our teeming youth in the state to address Sustainable Development Goal 1, Goal 2, Goal 4, Goal 5, Goal 8, and Goal 17, which is partnership. The center we are about to commission now will teach 14 different vocational training for young men and women. What we are doing today will definitely change the life of our young people for better. And I want to encourage all our youth that are going to be trained here at this center to consider themselves very, very lucky and to use this opportunity wisely, so that in no time you can all be employer of labor and thereby contributing positively to social economic development of your immediate community, which is Gombe State and Nigeria at large.
In Yobe State, the office commissioned a 100-bed mother and child hospital and a skill acquisition center in Gashua, among others. As part of efforts to improve living conditions, ensure safety, and build resilience for people affected by insurgency in Borno State, OSSAP SDGs delivered 300 two-bedroom housing units and other livelihoods-enhancing infrastructure at 2 internally displaced persons IDPs camp in Goza and Nganzai. At the Nganzai camp, the office commissioned a fully equipped 20-bed primary healthcare center, a skill acquisition center, a mini sport pavilion, a community hall, 4 blocks of 24 classrooms, a fully reticulated water scheme, access roads, and 400 integrated solar street lights. At the Goza camp, OSSAP SDGs delivered 100 housing units, a fully equipped 20-bed primary healthcare center, 3 blocks of classrooms, a complete water scheme, access roads, 500 solar street lights, and market shops for economic activities.
This intervention is one of the many interventions that our office has done across our country, Nigeria, signaling the significant moment of the people of Borno State. These houses have been specifically designed to provide dignified shelter and restore hope to the victims of insurgency in Borno State, especially in Goza. The construction of these houses is a testament to the commitment of our office towards fast-tracking the achievement of sustainable development goals in Nigeria.
In Kaduna State, OSSAP SDGs delivered 100-bed mother and child hospitals in Dandora and Dusen Aba, Zaria, in addition to the rehabilitation of the Ahmadu Bello University Teaching Hospital, among others.
The commissioning of this state-of-the-art 100-bed renewable specialist hospital here in Zaria, it is about reaffirming our shared commitment to humanity, improve healthcare delivery, and sustainable development.
In Kebbi State, the office commissioned the state-of-the-art 100-bed mother and child hospital in Samia village.
This edifice is not only going to be beneficial to Samia people. There are other catchment areas, including our dear good neighbors, the Benin Republic. This is 100-bed hospital for mothers and child. This is a clear testimony that the federal government has not forgotten us. This administration, under the able leadership of President Bola Ahmed Tinubu, is people-oriented administration.
In Kano State, OSSAP SDGs constructed and equipped a 100-bed multipurpose hospital in Tofa, as well as 80-bed mother and child centers in Murtala Mohammed Specialist Hospital and Abdullahi Wase Hospital. The office also rehabilitated key facilities including Murtala Mohammed Specialist Hospital, Abdullahi Wase Hospital, the Infectious Disease Hospital, and Abubakar Imam Urology Center. These interventions are designed to reduce maternal and infant mortality in line with SDG 3, good health and well-being. Beyond infrastructure, OSSAP SDGs has placed strong emphasis on data, accountability, and transparency through Nigeria's voluntary national reviews and the development of inclusive data systems. The office continues to strengthen evidence-based planning, ensuring that policies are informed by real-time data and that progress is tracked with clarity and precision. Recognizing that sustainable development cannot be achieved in isolation, OSSAP SDGs has cultivated strong partnerships, working closely with state government, development partners, civil society organizations, and private sector. Through these collaborations, the goals are being localized and embedded into state-level policies, budgets, and community-driven initiatives. Innovation remains a cornerstone of this journey, from supporting digital solutions that improve service delivery to fostering youth engagement and advocacy through platforms such as the SDGs Film Challenge and Awards. OSSAP SDGs continues to inspire a new generation of changemakers. Yet, perhaps the most enduring achievement lies not only in the projects delivered, but in the system strengthened.